Grammetry powered by the Vortex screws. So every time you order a Grammetry kit, you'll get some Vortex screws, you'll get a Vortex driver, and you can order these hubs if you want these hubs as well. And you can use a manual torque driver, like a hand torque driver, to be able to torque these screws out at 15 Newton centimeters for your full upper arch. Now, how do you, what's the Grammetry kit, the OptiSplint, what does all that look like? So if you buy a kit, this is what you get. You get all these OptiSplints here, 6 screws, some handles, and frames. Basically, each one of these little OptiSplints gets screwed into each individual multi-unit abutment, and you take these wire frames and seat them on top of this area, and you lead it all together. And this is kind of like your verification jig. You can scan these in the mouse, but it's not as accurate as scanning on a tabletop scanner. So I do scan these in the mouse. You don't have to, but I do. And I take them out to be able to stitch them outside the mouth using a tabletop scanner. Or you can just mail them off to your lab to get an accurate fit. So this is the lower this is the lower pre-op. So this is not my case. I actually helped somebody restore this case, but this is the this is the lower arch. I removed it and I scanned the tissues. So my protocol for this case would be to if this lady's vertical is correct, scan her upper arch, scan her lower arch, like in the upper left photo, and scan her bite, left and right side bite. And that would give me my vertical dimension for her. So to be able to cross mount that, I would remove her provisionals and now scan her tissue. That gets cross mounted back. Now I OptiSplint and OptiSplint scan, which you see here. And then I'm able to redesign and reprint her a lower arch to try in, and that's what you see here. So this is just a side-by-side compare analysis, preoperative soft tissue scan, OptiSplint scan. Again, you can scan this in the mouth if you want to. It's not necessary. What's really important is that you get this scan on a tabletop scanner for more accuracy. All right, and you get that. So in this is, once I just tack it in the patient's mouth with a little bit of old composite, and I'll unscrew it, and then I'll just take a bunch of cheap jet acrylic, and I'll just load that thing up. So I don't want this thing to move. If any of those move, it's not accurate. It's not going to fit proper. And all I did was just cross mount. So I cross mounted the OptiSplint scan with the provisional scan with the soft tissue scan. Actually, this is the OptiSplint scan intraorally with the OptiSplint scan, or the Grammetry scan on the tabletop scanner. And this is superimposition of all of them, and this is superimposition of the provisional scan with the final design scan and the OptiSplint scan all in one.